Good day everyone. My name is Antoinette Pedad, AMDNA second year college student. So now I'm going to demonstrate the oxygenation or oxygen therapy. The first thing to do is wash hands. So I'm going to use a isopropyl alcohol, proper hygiene. Next is check the doctor's order for the patient. Okay. Next is explain procedure and hazard to the client and introduce yourself and get the name of the patient if the patient is right for our procedure today. So, mayo buntag ma'am, mo tala day sa imong pangalan ma'am. Sa imong pangalan ma'am?
Pedad.
So, good morning Mrs. Pedad. Ako da ay si Antoinette Pedad. Ang imuhang nursing karong adlaw. So, ang kuan sa doctor is tagaan tika og oxygen therapy. So, unsa may purpose sa oxygen therapy? For you, it will going to help you to improve your breathing and to lessen your chest pain and for you to relax and sleep well at this night. So, after explaining, assemble all needed equipment. So as you can see, my equipment is not the actual equipment. It's actually improvised. So it's a do-it-yourself, DIY. So I improvise the equipment for the oxygen therapy. So after that, assemble all needed equipment. Check the oxygen source setup. So like this, check everything. Fill the humidifier line with distilled water and close the container. So attach the humidifier and flow meter into oxygen source. So assuming then attach the oxygen tubing and nasal cannula to the flow meter and turn on to the prescribed amount of flow rate, 1 to 5 liter per minute. So the doctor said that I'm gonna use for the patient a 3. So attach. Excuse me, ma'am. Next is check the bubbling in the humidifier, and you can see in this oxygen tubing there's a hole, so you can check in your wrist the breathing. There's always a breathing oxygen, there's air. So yeah. Next is place client in a comfortable position, semi or high Fowler's position, like this. Then place the nasal prongs to the client's nostrils. And secure the cannula over the client's ear and or place the mask, the tent in the client's face, snugly with elastic band. So that, then position the oxygen delivery equipment appropriately. So assuming that we have the oxygen delivery in here, so make sure that it is safe and in the right position. Next is post a no smoking sign in the patient's door and the view in the patient's visitor. hours. So this is sign no smoking. Next is check the proper flow rate every 4 hours. So assess the client's nostrils every 8 hours. Okay. So assuming that we're all done, do not forget to document the oxygen administration therapy, the flow rate, and the time of the therapy began. Note the patient's response to the therapy and any changes uh, during the patient's condition. So that's all. Thank you.